everyone, and welcome. Welcome to the webinar tonight, brought to you by Gen 5 Fertility, with Dr. Wood as our speaker. Tonight, we are going to be discussing egg freezing and its benefits, and who can be candidates for it, and if it's something to consider. Dr. Wood, he's a unique fertility specialist and scientist. And here at Gen 5, we do so many things from ovarian rejuvenation to insemination, IUI insemination, IVF. We have an egg donor agency for those who need to go in that route, and a surrogate agency for some that also need those services. But we're happy tonight to be talking to you about egg freezing and the advantages of doing that now. So Dr. Wood is voted one of the top doctors in the US. He's America's top doctors and rated superb and super doctor. He is the only fertility specialist in the world honored as Who's Who in the World and Who's Who in America, Who's Who in Science and Technology, and the recipient of the Marquis Lifetime Achievement Award and the 50 People to Watch. He's also certified as a high complexity laboratory director in molecular diagnostics. He is a director of a reproductive genetics lab who does future testing on embryos once you create embryos. He is featured in New York Times, BBC, Newsweek, and over 100 television and radio programs. He's a specialist with infertility clients with even low prognosis and many unique techniques and protocols that he does. He uses many special techniques, including the platelet-rich plasma, MPLAF, Ultra, and Ultimate, to enhance fertility under challenging circumstances. And he's active research program with many scientific publications over the past 3 years. He is our medical director here at Gen 5, the president and a founder of Gen 5. And so I'm happy to be introducing Dr. Wood tonight, who will be discussing further with you about egg freezing.
Okay, I think we're set. Now, I'm not great at this electronic stuff, so I'll take just a moment. I'm going to go share screen. And then I'm going to go here. All right. Thank you so much, Shani. I really appreciate that. You know, egg freezing means a lot to me because you know what it's about? It's about women finding freedom. And that's why I have that as a subtitle. And my whole life, because of my mother, for me, it's all been about women and about women finding freedom and how in the past they didn't have very much freedom. But now they do. And one of the things that accomplishes that for them is egg freezing. So I'm thrilled to discuss that with you tonight. I'm going to hit this button and hopefully everything's going to work. You know what it's all about, these babies. I love this picture because it really doesn't show any of these babies' faces. It just shows them as a baby. It shows the diapers and their various different skin colors and ethnicities. And they all have a chance to do something amazing, to do something incredible. And that's what I hope they all do. But when you look at these babies, you have no idea who any of them are or what they can accomplish. You don't look at their skin color. You don't look at their hair color. You just look at them as babies and know that they can accomplish anything. Now, I'll tell you, this is the most unfair graph I have ever put on a screen. This is the effect of age on male fertility. And as you can see, there's really not much of an effect. Look there at age 80. There's a guy with incredibly high sperm count. It's unfair. And you know why it's unfair? It's unfair because of this. Look at this. It looks completely different, doesn't it, from the male factor fertility slide? Because here you see that there's a profound effect of age on fertility. Take a look at the kind of aqua area that's highlighted there. You can see that at age 30, it's quite high, but by the age of 35, it's fallen tremendously. And that's when most of the patients that do egg freezing, that's when we see them. It's between the ages of 30 to 35. We have some in the late 20s and we have some beyond age 35, but in general, it's between 30 and 35 because women are smart and they realize this is the time that fertility really falls a great deal. And this is the time where, in general, egg quality is quite good. This is the time to freeze eggs. And they know that, and that's when they do it. We have some patients that freeze eggs at 40 or just beyond 40, but in general, it's between 30 and 35. Now, what is the solution to this falling female fertility rate? It's such a problem. It affects women in such bad ways. They make bad choices and partners. They don't take certain jobs that they should take because they're worried about their fertility. Well, the tradition is, well, just have eggs earlier, have them in the 20s and then start your career in the 30s. But of course, that really doesn't work very well, does it? And so other women, they decide to freeze embryos. They find a partner, whether or not it's the right partner, but they find a partner and they freeze embryos. Or they pick a sperm donor and they use a sperm donor to make embryos that they freeze. Now, there are some women, and that's their choice to do that, but the majority don't want to do that. Majority really want to find the right person and do things well, do things as they think they should be done. And so the more modern method is to freeze your eggs. Now, it turns out that freezing eggs was a very, very difficult thing until quite recently because we didn't know how to freeze eggs. And so it's very nice now that we've learned how to do it. It turns out not many fertility centers have learned how to do it, but in general, we know how to freeze eggs. And this gives women a great deal of freedom, as we'll see in future slides. Well, what is egg freezing? Well, IVF. That's what I do the majority of the time. I do IVF. What that means is that eggs are fertilized in the lab, and then they're grown to the right stage so that implantation can happen, and then they're frozen, and then they're stored. But you know what? You can't unfertilize an egg. Once you fertilize it, that's it. You can't go in, you can't take the sperm out. You can't say, I was just kidding. I want to do something different. I found the right person for me. I want to do something different. Unfortunately, you can't do it at that stage. So the thing I love about egg freezing and that women love about egg freezing is that you freeze unfertilized eggs. Unfertilized. So these eggs have every possibility available to them in the future. It's not like it's over. It's over once you fertilize an egg. It's unfertilized. And so later you can decide who you want, or if you want to use a sperm donor, you can decide to do that with these eggs. And so you can freeze these eggs for a very, very long time. And that's fantastic. It's really amazing that you have a fertilized egg and you can keep it. You can store it for years and years, for decades. And then one day you decide to use it. And you can create the embryo you want. You can have the baby you want. So egg freezing is really an astonishing thing. It's an amazing thing. And I'm so glad it's available because as I say here on the slide, all options are available when you freeze eggs. So why do egg freezing? I'm sorry for the typo there. Well, one group of women, they want a child now, or maybe in the future, but they don't have a partner, or they don't have a partner that they really want to be with. They're skeptical about the partner they're with. The chance of finding the right partner is really, really low. And so these are wise women. And they say, I do want to have a child and I want it to be with the right partner, but I don't have one now, or I don't have the right one now. And so it's very nice to be able to freeze those eggs, and then you can make the choice when the time is right. Also, some women, they're relatively young, but their reproductive hormones, they don't look good. the AMH has fallen, the FSH has gone up. When an ultrasound is done, there are very few follicles there, which means very few eggs. And they realize time may be short. They realize that if they don't freeze their eggs now, in the future, they may not have very many eggs. So that's another major group. Also, women have breast cancer, have other types of cancer, and they know that an upcoming treatment or surgery is going to happen that can tremendously affect their fertility. If you have breast cancer and you need to undergo chemotherapy, that can wipe all your eggs out. And they want to make sure that they keep eggs that are going to yield a high chance of success in the future. Others have a career goal. They'd love to have a child or want to have a child in the future, but they realize if they don't continue on with their career, that it's not going to get them where they want to be. And so it's really nice to be able to freeze eggs and have a chance to accomplish everything you could possibly accomplish. And then there's a big group, and I'll talk more about this in a couple of minutes, but a big group where a woman is with a guy or considering being with a guy, but she's just uncertain about it. And we all know that divorce rates are roughly 50%. And to be with a partner like that, and you're trying to decide what you want to do with your reproductive future, it's a very, very tough thing. And so, as I said, we'll go through some more details about this, but this is becoming an increasingly larger group of women that make the decision to do it for that reason. And then, of course, sometimes a woman has the partner they want to have a baby, they do an egg donation cycle, and they simply don't have sperm. They have plenty of eggs. The eggs look beautiful. Everything looks very positive, but for whatever reason, that day, the guy cannot produce a sperm specimen. And that used to be a horrible situation. I remember many from the past like that. But the beautiful thing is today, we can take those eggs and we can freeze them, and they're still going to have an excellent chance of being able to have a baby in the future. Now, I've kind of alluded to this a little bit, but egg freezing falls in two categories. One I call full, the other is called partial. So most women that freeze eggs, they freeze every egg that they make for one of the reasons that I mentioned on the last slide. But what I'm seeing more and more, and I really respect this, is a lot of women now do a partial egg freeze. So they're with somebody. They think they want to have a child with that person, but they're not sure. And they know this might be the last chance to have eggs that have a high probability of success. And so I've had many, many women come in and they make 20 eggs. And they tell me, look, I want you to fertilize 10 with my partner. And I hope things work out with my partner. But if they don't, I want to have 10 frozen eggs that I can use in the future if I need to do that. And I have such respect for them. And we do this routinely. And I respect that women want to protect their future. Remember, that's what I said at the beginning of this talk. Women should protect their future. So how is egg freezing done? Well, typically the age it's done is 28 to 37. We have some women in their early 40s that freeze eggs, and we do have a few women below the age of 28. But it turns out that 28 seems to be kind of a magical number for thinking about the fact that you need to freeze eggs, that you need to have high quality eggs in the future. How you do the egg freezing, when you do the egg freezing, all those things are all about you. It's whatever you decide is right for you. No one should tell you what to do. It's your decision. You do it when you want, and you do it the way you want. So we have women that come in and they say, I don't want a huge number of eggs. I just want to have a reasonable number of eggs. And we use a different protocol for them than women that say, I want all the eggs I can get. I don't know what my future holds. I want to make sure I have every possible probability of success in the future. And we're happy to do that. So how does it work? It's a lot simpler than you would think. A woman comes in, let's say she's ovulates each month, and we say, okay, on day 21, we're going to start you on some hormones. And those hormones are going to synchronize the follicles so the follicles grow together during the cycle. And that's really important. You don't want a bunch of eggs that have different levels of maturity. You want eggs that are mature, eggs that you can freeze, eggs you can count on when you thaw them that they're going to be able to fertilize as they should. So they take birth control pills for X number of days, somewhere between 10 and 21 days. They stop for 5 days and then they start a cycle. Now, this cycle is a lot simpler than you would think. They take medication for 10 days, and then 2 days later, the eggs come out. And that's really all there is to it. We let them know how many mature eggs they had. We take a picture of every egg that they have so that they have that forever. And then they store them, they freeze them, and they decide when to thaw them out or if they're going to thaw them out. Nobody tells them what to do. They decide. So what happens after an egg retrieval? It's freedom. It's freedom. I've seen so many women come in and they're so worried about their fertility future. But once they freeze eggs and they're mature eggs and they're good quality eggs, suddenly they have freedom. They can do whatever they wish with their life and they don't have to worry about any pressure. They don't have to be with someone they really don't want to be with just because they're worried about their fertility. They get to achieve their career goals. And then later, they have these eggs that are still the same age as they were when they did the egg retrieval. It's really an amazing thing. So they're stored in liquid nitrogen. Now that's minus 196 degrees. That is really cold. And the thing about something being stored at that cold a temperature is nothing happens to those eggs. They are safe. They're protected. We have cameras on them. We have sensors in the tank. We check everything. We make sure that they're taken care of. Now, this is what a liquid nitrogen tank looks like. It's extremely cold. This is actually a dangerous thing. It's so cold. It sucks all the oxygen out of the room. So when an embryologist works with these tanks, they actually have sensors in the room to make sure that everything is safe for them. But from the standpoint of the woman that donated the eggs or froze the eggs, it's amazing. Everything is safe. They are protected. Now, like anything else in life, there are issues with egg freezing. Let's go through those. It is possible that you're 33 years old, you freeze eggs, and you don't decide that you want to thaw them out, fertilize them, and transfer them until you're into your early 40s. And so at that time, you might try to get pregnant on your own, and you may succeed. If you do, you might not need those eggs. So whenever you freeze eggs, there's always an understanding that you may or may not need them. But they're there. They're there if you do need them. And because they're stored for many years, many women become concerned. Are these eggs going to be okay? But as I said in that last slide, they are going to be okay. They are going to be protected. It also can be difficult to select the right center to work with because of these delays. In other words, there are many centers that freeze eggs, but they rarely thaw them. In fact, they may have many eggs that have been frozen for 5 or 10 or 15 years, but they've never actually thawed them out. But remember, what's really important is not that the eggs were frozen. What's important is that they can be thawed out. And when they're thawed out, they're going to be viable. They're going to be high quality. They're going to lead to a successful, healthy embryo. So what do we do with egg freezing? This is, as I said, this is something that means so much to me. We have so many women come in and ask about egg freezing. And I think education and understanding is critical because they may have read something in some magazine somewhere or seen some show that said this or that. But what's important to me is they really understand. They really understand why you should do it, why you should consider it, and they can decide if it's right for them. I want them to understand every aspect of the process, what's going to be involved in creating the eggs, how likely it is that those eggs are going to be high quality. I want them to understand. Now, as far as Gen 5 fertility is concerned, we're concerned mainly about three things: setting up the right environment. So when I set up Gen 5, I said, I want to create the best fertility center possible. And that's what we did. We have something called Life Air. And Life Air creates the cleanest, the best possible environment for eggs to grow in or live in until they're frozen. As far as I know, nobody else in Southern California has that. Why? Because it's expensive. It's expensive. It limits people's profit. But no one should be doing fertility because they want to make a profit. They should be doing it because they want to help people. And that's why we chose this technique, which yields the highest possible quality eggs. Then you have to use the right protocol. Use high doses of medication. In many cases, a woman's egg will actually be reduced in quality. You don't want to do that. You want to do everything you can to give them the highest quality eggs. And so we use low dose protocols. We use special techniques along with those low dose protocols to give the most possible eggs that are of the highest quality. And then people. People are the most important thing. Our clinical staff, they're amazing. I adore them. I feel so lucky to work with them. And we have some of them that specialize in egg freezing. They know what it's like to go through egg freezing. They know what issues are important, and they're there. They're there to take care of those issues. And we also have an IVF staff that is just simply amazing. I'll discuss them more in just a minute. And it's very important that they understand that freezing these eggs is very different than usual IVF. And they understand that, and they do a great job with it. Let me see what I need to do to go to this next slide. There we go. Now, I'm very proud of our egg freezing IVF staff. We have 3 senior embryologists. 2 of them specialize in egg freezing. They specialized in egg freezing for years. They're extremely good. The 3rd senior embryologist is extremely good at it, even though it's not something she specialized in. So the other 2 are the ones that are most likely to freeze the eggs, but they're all extremely good at it. One of the embryologists actually froze and thawed 1,500 eggs last year. That's her level of experience. And as I said earlier, freezing eggs is one thing. Being able to successfully thaw those eggs, fertilize them, and grow them to the stage that they can implant, that's an entirely different thing, and that's the most important thing. So I think it's extremely important that you really think about this decision carefully. This is a major, major decision that you make. What fertility center you choose and whether or not you choose to freeze an egg will likely have a profound effect on the rest of your life. You have to look at the quality of the care you're going to receive. Go talk to a fertility center, see what they're like, see how much they care about you, how much they care about freezing your eggs, how important it is to them to freeze your eggs and to freeze them correctly. One of the things to think about here is you've got to consider your future. If you're planning on getting pregnant in the next 3 months or next 6 months, if you have a partner now, there's no good reason to freeze eggs. As I said, you may choose to freeze some and not freeze others. But if it's that close in time, there's very little reason to freeze eggs. The second thing is you don't know what the future holds. You really don't. And so some of the women that we freeze eggs for felt like they were with the right person. Everything was going well. They thought they were going to get married soon. They thought that they would be able to have a baby soon. But unfortunately, that did not work out. So no one knows the future, and no one knows your reproductive future. The beauty of freezing eggs is that those things don't matter. Those things are put away, they're frozen, and you have all options in the future. So let's go over some common questions. How long do frozen eggs last? Now, no one really knows, but the experts say 990 years. And none of us are likely to live that long. So when you freeze your eggs, there's no doubt at all that those eggs are going to be good. Whether you decide to thaw them out in 5 years or 10 or 20, even 30 years, those eggs are going to be just fine. Another common question is, can my partner or my future partner get their hands on my frozen eggs? And the answer is no, they cannot. They belong to you. You are the only person who will ever make a decision about those eggs. So it's safe. Yeah, if you freeze embryos that some other person was involved with, there can be lots of problems. I'm sure you've seen in the news lawsuits and things about embryos, but not about eggs. Those eggs are yours, 100% yours. Another question is, how many eggs do I need? And this is a tougher question. In general, we recommend nine. But sometimes 9 doesn't work. It's rare. In general, if you have 9 high quality eggs, you're fine. You're going to be fine. And so sometimes it's 12, sometimes it's 14. But if you read in a textbook, for example, if you get bored and go to a medical library and read in a textbook, they say 20. But I'll tell you, my experience is you put away 14, you're going to be good. What's the future? In the future, you may be able to create eggs from skin cells. Someone may be able to do a biopsy, take a few cells from your skin and be able to create eggs from them. When that happens, you won't need to freeze eggs because you will have a full supply of eggs from all the skin cells in your body. But that will be many years from now. You also might be able to do nuclear transfer. You might say, I don't want to freeze now. I'm just going to wait. I'm going to see what happens. And then someday when you're 40 or 45 and you decide you want to have a baby and you try and you see it's really, really tough. And so there's something called nuclear transfer, which means that the nucleus from your egg is removed and it's placed into the nucleus of an egg donor that's had its nucleus removed. So the genetic material is from you, but the rest of the cell, the rest of the egg is from the egg donor. And I think there's a great deal of potential with this. Unfortunately, it's just not available now. So until then, what do? Egg freezing. And it's a wonderful thing that high quality egg freezing is available right now. I love to show this picture. These are my kids, my daughter and my son, and their dog. His name is Larry. They're wonderful. And this is what it's all about. Someday, almost certainly, you're going to want to have a son or a daughter. And for sure, you're likely to want to have a dog. So our goal here at Gen 5 is to help you achieve your dreams. So thank you so much for listening. And I will pass it back to Shani, and we're happy to answer any questions you have.
Thank you, Dr. Wood, for an informative discussion. There are a few questions that were submitted by our audience, so we'll be going over as many as we can, everyone. And then whatever we do not have time allotted for, then we will go ahead and be answering you via email and hopefully here in person at the clinic. So first of all, this is kind of a two-part question. Is 37 years old too late for egg freezing? And how do you decide when you use conventional IVF or mini IVF?
Excellent questions. We've had a great deal of success with 37, even 38-year-olds. After that, it gets more difficult. We have women come in, they're in their early 40s and they want to freeze eggs. It's a tough thing. So I would definitely recommend that no later than 37, 38, you freeze your eggs. And if you can freeze them before you get to 35, that's even better. Egg quality is really outstanding before the age of 35 for the vast majority of women, and then for some women after the age of 35. So I'm sorry, Shani, what was the second question?
How do you decide for the
Uh,
egg
uh,
freezing if it's conventional or mini?
okay, I love that question. I tell you how we feel. Nothing else should ever be done except mini. And it turns out, I don't know why, because there's several studies about this, that many fertility centers think there's some vast difference between conventional IVF and mini IVF. It's simply not true. You can use mini IVF doses and get just as many eggs as you would with conventional IVF if you do the protocol right. So it's very rare that we go above mini IVF protocol hormone levels. It's very, very rare. And we get the exact same number of eggs, only they're higher quality. Eggs don't want to be pounded with huge doses of medication. It's not natural, it's not normal. And many times they're poisoned by these high doses. And I think one of the most common reasons for failure, and every day I see patients that have failed, in some cases, many times before. This morning, I talked to someone, Shani and I talked to someone, I think she failed 8 or 9 times before. And a lot of times it's because the dosage of medication is just too high. If anyone tries to do that to you, you say no. You say no, because they cannot present you with one piece of evidence that using high doses is better than using low doses, using more appropriate doses and focusing on egg quality rather than trying to get more eggs. And as it turns out, if you look at studies that look at egg numbers, there's no difference between doing a mini IVF cycle right and doing conventional IVF.
Thank you. What is the cutoff for a follicle count or AMH to determine egg freezing?
Well, okay, I see. I think what you're saying is there a case that too few eggs are worth freezing? I don't think so. The younger you are, the higher quality those eggs are. And let's say you're 33 and you only have 3 or 4 eggs. Imagine what things are going to be like a few years after that if you don't freeze them. They're going to be much worse. However, at 33 or 34, the chance that those eggs are genetically normal is much higher. And so I would advise you to freeze those eggs. And I know there's some fertility centers that say, oh, you have to have eggs. You have to have wire. We're not going to help you. That makes no sense to me. You have to take care of someone the way they are now. You have to give them the best chance of success the way they are now. So don't worry about egg number. Instead, freeze them. Give yourself a chance later.
If should you recommend ovarian rejuvenation, how soon before egg freezing should ovarian rejuvenation be done?
As everybody probably knows, egg freezing is very close to my heart. I've seen so many women that had no chance that were able to succeed because they did egg freezing. So it's a little off topic to go into that in much detail. But in general, what you do is you do egg freezing and then you start a cycle 4 weeks later. And then 12 days after that, that's when the eggs come out. And you can either choose to fertilize them, or you can choose to freeze them as eggs, or you can do 50-50 or 75-25, whatever you want to do. It's your call.
What is the percentage of loss in number of eggs during the thawing process?
That's a great, great question. It varies woman to woman. Some women, it's tremendous. You freeze and you thaw, it's 100%. Some women, when you do it, it's much lower than that. So there's a lot of variation in that. But we looked at a large group of women over several years and it was 98%. But it's not really 98%. It's about you individually in terms of how they thaw. That's a great question, and it's definitely something to think about before you do this.
Should you avoid heavy weightlifting before and during the freezing of the eggs?
I think absolutely you should. When you lift heavy weights, you strain and you reduce the blood supply to the ovaries. Now, has anyone done a study that really looked at this, that looked at the effect of different weights on egg quality? No. But I think it just makes sense not to do something that is quite likely going to reduce blood flow, at least in the moment that you're doing the weightlifting, when you're trying to do an egg donation cycle. Remember, the cycle is only 12 days long. And so, although I know many people believe, and I do too, that weightlifting is important, to not do it, to not do heavy weightlifting for 12 days seems like a small thing to do to give yourself the highest possible quality eggs.
All right, we have time for one more question. Again, if we've missed anyone's questions, we'll be following up with you for those answers, so we won't miss anyone. The last question, are there any contradictions for egg freezing?
Contraindications, only the same kinds of contraindications you would have for doing an IVF cycle. So there's some women that have significant arterial disease, heart disease, things like that, high blood pressure. We look at everyone very carefully. We have a team of people, medical specialists, that look at each patient that wants to do things. And what we found over time is that the vast majority of time, let's say 98, 99% of the time, there's a way to do that cycle that's safe for the patient and that also gives them what they desire in terms of either eggs or embryos. So if you have a concern like that, let us know. We'll have our medical team look at it and we'll give you an answer very soon thereafter.
Well, thank you, Dr. Wood, so much for all this information. And thank you all for joining us and taking your time out tonight. We look forward to seeing you here at the clinic. Be sure to utilize your certificate for attending and meet Dr. Wood in person. Thank you.
Thank you all for being here.